Hi everyone, Dr. Jeff here today. Today we're actually talking about breech babies. Well, what is a breech baby? Well, if you're pregnant, a breech baby is a baby that does not head down. Usually at 37 weeks, the head should be down in the pelvis, engaged, ready to push on the cervix. Because what has to happen for delivery is that when the uterus contracts, the head of the baby pushes on the cervix and dilates the cervix and opens it up and actually creates an opening for the baby to come out. And if the baby's not head down engaged, it's usually called a breech baby. And sometimes it could be the bum that's down, that's called a frank breech. And sometimes they will let that, you deliver with a frank breech baby because the bum can actually push down on the cervix and dilate it. But unless the head is down, usually they end up sending you for a C-section for delivery. So it's very important at 37 weeks that we have that head down. Well, what can we do if the head's not down? Well, Dr. Larry Webster was a chiropractor who years ago developed something called the Webster's technique. And what they found is that the uterus is inside the abdomen. It's really supported by what we call round ligaments that kind of support it inside the abdomen. And if the pelvis is off alignment a little bit, or the low back is off alignment, and as the uterus grows, these round ligaments become tighter and tighter and tighter to support the growing uterus. And what will happen is that it limits the amount of space that this baby can, the fetus can roll around inside, so the baby can't actually turn to get its head down. So what they found is a different type of technique where we do some leg length checks and some resistance checks and find out how the alignment of the pelvis is setting up. And if it's out of alignment, there's some gentle adjustments we can do. Then we get in and we actually do some trigger points on some of those round ligaments to loosen them up. What they have found from some of the research they did is one of the papers I read is that of the 700 breech babies that Dr. Webster treated, all but 18 turned in time for delivery. Other than the Webster's technique, some midwives will do some we call external version, where they come in on the outside and they actually try and turn the baby in. Sometimes that's successful and sometimes it's not. But if you know someone who's suffering from a breech baby and are looking for something to do for it, you can send them our video or have them come in and see me, and we can certainly talk about what Webster is all about. I'm Dr. Jeff, and I've got your back.